Well, as we just heard, COVID-19 numbers across the country are on the rise, which means now more than ever, you need to be safe. And you're probably asking a few different questions than you were when all of this started. So in today's To Your Wellbeing, we're taking a closer look at what you need to do to stay healthy. Cone Health's Chief Physician Executive, Dr. Bruce Swords, is joining us. All right, so let's just go ahead and talk about the numbers first and foremost. What do they look like?
Yeah. Good evening, everybody. The numbers aren't good. We are at a record high of hospitalizations, at least within the Cone Health facilities, which is concerning. We were encouraged a couple months ago when we saw numbers declining, but we are back to a record high, have around somewhere in the 80 to 85 patient range right now.
Okay, so we're hearing that the numbers are continuing to tick up. We heard from Guilford County Schools today. We continue to hear that wearing a mask is still very important. So let's talk about when and who should be wearing a mask and how it should be worn.
Great. Masks should be worn, period. And we'll talk about when, how, and where. But it's also important to know that wearing a mask is based on science, and that it's very clear that when people wear masks, especially when people who are interacting with each other wear masks, the risk of transmission is very, very low. And so you should wear a mask when you are with people that you are not normally in contact with. So if you're at home, presuming that nobody in your home has recently encountered COVID, you should be pretty safe not wearing a mask at home. But if you are outdoors or going out to the grocery store or to a home improvement store, any place where you will run into other people, you should wear a mask. If you work with people, you should wear a mask. The mask should, this seems too obvious to a lot of us, but I'll go through it anyway. Masks should be worn over the mouth and the nose. There shouldn't be any under the nose or on the chin. The mask is there for a reason, and you put it over the nose and the mask. Simple, but we all see folks who don't use their mask correctly.
Yeah, I think just the other day I was at a setting where people were outside, they were all wearing masks, and when the person went to go talk to somebody, they actually took the mask down so that they could talk to the person. And I thought, that's exactly what you're not supposed to do.
Yeah, that's right. Is if you are talking to somebody, wear your mask. If you are outside, outdoors, exercising, and you're not around people, you don't have to wear a mask. But if you are outside with a group of people, wear a mask. And for heaven's sakes, if you're talking with folks, wear the mask.
Okay, so what are the dangers of not wearing a mask?
Yeah, it's pretty simple. The danger is that, again, I'll back up. The thinking behind wearing a mask is that if I wear a mask, I'm protecting you. If you wear a mask, you're protecting me. So the real danger is if I don't wear a mask and I have COVID, I'll give it to you. And that's just not part of being a good community member. Is my job is to protect people that I don't know, and respectfully, I'll ask that you wear a mask to protect me. And it's sort of this bi-directional agreement. It's very simple, and it's based in science.
All right, we heard before that we need to, do the social distancing 6 feet apart. I've also seen that people sometimes when they're wearing a mask, they get closer because they think to themselves, well, I'm wearing a mask. I can get a little closer to have this conversation.
Yep, good point. I don't want to choose between the two. I want you to, and I want myself to wear a mask and stay away from people. That's the best thing to do. So if we can wear a mask, stay 6 feet away from each other, we'll be in good shape, and we will see our numbers decline, and they'll decline over the next few weeks. Right now we're seeing information, again, record highs in our hospital, and we can see that the transmission rate is increasing as well, and that's very concerning for the future.
All right, and so, then that would lead you to then ask what will happen if people don't follow the guidelines, the 6-foot distancing, the masks. Are we already seeing what's happening when people aren't doing those things?
Yeah, I think that's right. Is we are experiencing uh, the effects of when people were not wearing masks and gathering together and not socially distancing from 2 weeks ago. It takes a little while for the coronavirus to transmit and for people to get sick and then sick enough to end up in the hospital. And that's what we're seeing now.
All right, so temperatures are certainly, getting cooler and this, that, and the other. A lot of us had our heat on just over the weekend. So what advice do you have for people who are finding themselves indoors more often over the next coming weeks?
Yeah, my recommendations are going to sound very similar to what we just talked about, but the risk is that when people are indoors, they're going to be close to each other and air will circulate within a confined area or confined room, increasing the risk of transmission of coronavirus. And again, if we are able to wear a mask, wear it over your mouth, wear it over your nose, and stay away from each other, the risk of transmission decreases dramatically. If we can wear a mask, stay 6 feet away from each other, the risk of transmission is very low.
All right, Dr. Swords is going to be with us until 6 o'clock tonight answering your coronavirus questions. Here's how you get one of your questions answered. You text us the question, 336-379-5775. Again, this is text only. We don't take any call questions. We take text questions. So make sure you text us your question and we'll be right back.